Today's topic is the mitral valve surgery, and I'm very happy to have one of the best surgeons in Switzerland, maybe Europe, maybe in the world, Professor Grünenfelder. Thank you for joining. And the topic today is mitral valve surgery, and explain a little bit what the procedures are and some other common questions around the entire world of mitral valve surgery. So first of all, thank you for joining. Maybe we can start a little bit with just talking about the surgical procedure. If you could maybe explain a little bit what you actually do during this surgery.
Yes, I can try to explain a little bit the surgery in the case of a mitral valve disease. Usually the patient who gets operated has a mitral valve insufficiency. That means that the patient has a leaky mitral valve, meaning that the blood goes backwards into the lungs and causes problems to the lungs and also to the heart if not treated. So what we do, we usually try to repair the mitral valve in itself. So that means that we suture the leaflets. There are two leaflets of a mitral valve. So we suture the leaflets according to the anatomy and implant sometimes additional chordae, meaning suspensions of the valve to make the valve competent again. So this
how do you do this? Do you have to kind of open up?
Usually we do it minimally invasively. That means that we don't have to open up the chest bone anymore. That is an incision from the side, from very lateral, meaning very far away from the chest bone, and we go between the ribs into the chest and then can operate on the mitral valve. Of course, we have to use the heart-lung machine for this, and the heart-lung machine is installed in the groin. We have then access to make the heart stop, and then we can operate on a stopped heart to repair the valve. But it's not as we did in the past, so we have to open up the chest bone anymore. So that is quite an advantage to the patient. To the trauma is minimalized through this small incision. It's about the 4-5 centimeter incision into the chest, as I said, between the ribs, and that's it. So they have no much pain, a little bit 1-2 days, but then actually the pain is gone, and they can be rehabilitated much quicker, and they can actually go to work much faster than they would have done with a full sternotomy, what it's called, if you open up the chest bone.
Because one of the questions that I have been looking up in my research for this interview, what people seem to be very interested in is how long is the recovery time? And I'm assuming that if you do it in a minimal invasive way, the recovery time should be much better and faster, right?
Yes, that's actually the intention of minimal invasive surgery. So since you only have a small incision, you don't cut bones, you don't articulate ribs, then the pain is much less. So the trauma is much less than it would have been in a conventional surgery. So that's why people usually go home after 4 or 5 days.
Oh, really?
But that's not really something we are really keen on, having the patients out very early. In Europe, it's a little different than in the United States. We follow the patients a little closer. That's why we don't want to have the patient to come back for any other reasons. That's why we wait usually 4 or 5 days after the surgery to send the patients home. And since we are in Switzerland, we have the opportunity to send the patients to a rehabilitation facility, which we think is very advantageous to speed up the recovery much more, and to have the patients back to work earlier.
So we can say surgery and admission in hospital is 4 or 5 days. How long would the rehabilitation at a specialized center be?
Usually it's a program, and usually the program lasts for 2 or 3 weeks.
Okay.
So an additional 2 or 3 weeks in the rehabilitation facility makes the stay outside or away from home for 3 or 4 weeks.
Okay.
But,
so downtime is 3 to 4 weeks.
Yes.
Okay. I have one last question, and this is probably the top question that we have been finding in our research, and it's about life expectancy. So the big question: what is the life expectancy after a mitral valve surgery? Knowing it's probably not easy to answer, but
well, that's difficult to answer because every patient has his story and his diseases behind. But in general, if we operate on a patient who has just mitral valve disease, as I said, mitral valve insufficiency is the most common one, then the patient has a normal life expectancy. So if they have been operated in a high volume center with a good repair, that is very important, that the valve they operate has been done in experienced hands, and the repair is good, then the repair lasts usually forever, meaning the patient has a normal life expectancy compared to the normal population. Mm-hmm. So they are not coming back usually for a second operation.
Good. Well, thank you. We don't want these interviews to be too long. I think the most important questions have been answered. So Professor Grünenfelder, Hirslanden, Zurich, thanks so much for helping out and providing some inside experiences.
Thank you very much for having me.